Good afternoon, everyone. Welcome to the Fall 2020 Key Staff Meeting.
Thank you. Hello.
Next slide, please. My name is Amy Merrill, and today we will be addressing on our agenda, we'll introduce the new, our MPP quality team and the community resources, our new population health platform, Persivia. Coordination team will be joining to discuss what's going on with care coordination. We'll discuss the requirements for the 2020 CI scorecard, the physician education and the fall webinar, how to access the McLaren Physician Partners website and the updates, the year-end quality focus, the MPP blood pressure module, PCMH, and how can we assist your office. On August 24th of this year, to align with McLaren Healthcare corporate goals of establishing best practices across the system to reduce clinical variance, we centralized our MMG and MPP quality and care coordination services, with the exception of our CPC Plus program staff, to provide the benefits of enhanced efficiencies and services, achieve system corporate goal to the top decile performance and quality, maximize revenue and incentives available for value-based contracts, optimize hospital and ambulatory care coordination. This will allow us to follow our vision and mission statement. This slide here just explains the different roles that we all are a part of. If you can go ahead and go to the next slide. We're going to introduce us regionally, and I will let Judy from Flint and Lapeer start.
Sorry, I was muted. I'm Judy Karpinski. I am the quality performance specialist for Flint and Lapeer.
Hi, I'm Rebecca Sherich, and I am the practice coach for Flint and Lapeer.
Hello, I'm Sarah Dowlam. I do data entry for Flint.
Oops. Sorry, I was muted there. My name is Jackie, and I do the data entry for Lapeer, Port Huron, and Lansing.
Hi, I'm Janet Leitz, RN, Senior Quality Performance Specialist, Carroll, Thumb, and Port Huron.
And I'm Lori Dimich. I'm the practice coach for Carroll, Thumb, and Port Huron.
Hi, I'm Jennifer Davis. I'm the quality performance specialist for Bay and Central.
Hi, I am Jamie Imperial, and I am the practice coach for Bay and Central regions.
Hello, I'm Christy Beto. I am the quality improvement specialist for the Bay, Thumb, and Carroll regions.
Is Sarah on?
She is, I believe she's on via the phone.
All right, Diana, do you want to introduce yourself?
Sure. Hi, I'm Diana Babala. I am the data entry for Central, Bay, West Branch, and Northern regions.
Hi, I am Alyssa Cross, and I am the quality improvement specialist for the Central and Northern region.
Hello, I am Charlotte Meyer. I'm the quality assistant for the Northern region. Good afternoon.
Hi, I'm Kathy Moody. I'm the Senior Quality Performance Specialist for Macomb and Northern regions. Welcome.
Good morning. I'm Sarah Hart. I am the data entry for the Macomb region.
Hi, I'm Amanda Griswold, and I am the quality performance specialist for the Oakland and Northern regions.
Mariana DiLorenzo, and I'm the practice coach for Oakland Region.
And I am the quality assistant for Oakland.
Hi, I'm Carmen Gonzalez, and I do data entry for the Oakland region.
Hi, I am Sierra Sinelli, and I'm the quality performance specialist in the Lansing region.
Hi, I am Amy Merrill, and I am the quality performance specialist in the Lansing region.
Hi, I'm Elizabeth Shepard, and I'm the practice coach for the Lansing region.
Hi, I'm Mickey Sego, and I am a quality improvement specialist in the Lansing region.
Hi, I am Jessie Siebenik, and I am a quality assistant in the Lansing region.
Hello, I am Nina Skaggs, and I do data entry in the Lansing region.
Oh, apparently my button didn't turn off. My name is Stephanie Beam. I do data entry in the Lansing region.
Hello, everyone. My name is Jasmine Ahuja, and I work with the data team and the full quality team throughout McLaren.
Hi, I'm Allison Perez, and I'm the quality supervisor.
Hello, I'm Dina Miracle, the manager of quality, and I work for all the lovely people that just introduced themselves. Welcome, everybody. Next slide, please. If you have questions, please utilize the chat function, and we will answer any questions at the end of the presentation. There'll be a time for answering questions and answers at the end. Thank you. Now I'd like to introduce Keisha Crenshaw Walker from 211 as our community resource today.
Hello, good afternoon, everyone. Thanks for having me. As you mentioned, I'm Keisha Crenshaw Walker. I'm the Training and Development Director for Michigan 211. And I'm just here to give you a brief overview of 211, the services that we offer, and just give you an idea of some of the resources that are most requested by our callers. Next slide, please. Oh, well, that one is probably, yep, thanks. So Michigan 211, we're a statewide network, and we have 7 regional contact centers. So I work for the Michigan 211 state office, and we help those regional contact centers to kind of coordinate best practices, services, funding assistance. So we work on a lot of statewide projects together, but we do have 7 centers that are represented throughout the regions so that the callers can get local help. So people that are answering the calls, they live and work in the communities that they're assisting, as well as the resource managers that manage the resources in those communities. They also live and work in the same communities. Next slide, please. We handle over 400,000 calls a year, and that's statewide, and that results in over 1 million referrals for health and human services throughout the state. We also are available 24 hours a day, 7 days a week, and we can be reached by phone, text, chat, or web. And I'll just kind of show you a map and a little bit of how the service breaks down across the state. But we do have individuals that answer the calls that are certified resource specialists. So they're able to assess the caller's needs, and if there are any underlying needs, they're able to try and help them to meet those as well. Next slide, please. So I did mention that this is just a list of the ways that we're accessible. Again, you can dial the 3-digit code 211, and you'll be routed based on your zip code to the center that serves your area, or you can text your zip code to 89. Can you hear me? It told me that I was muted by the host. Can everyone hear me?
We can hear you, yes.
Okay, thank you.
You're welcome.
And you can also go to mi211.org and you can access our resource database and also see information on how to connect throughout the state. This is our coverage map, so you can see like the 7 regions and the way they are divided up by the centers, and the centers are listed there on the right. So each center is assigned a certain number of counties, and they service that community with resources as well as call handling. And you can move to the next slide, please. So these are our most requested categories for referrals: utility assistance. And usually right now, this time of year, the fall is when it really kicks into gear for utility assistance requests. And we're talking about people that want help paying their gas bill, their electric bill, help with home heating fuel. And those requests kind of really spike in the fall and winter. And then we have requests for food assistance, and that's everything from emergency food, hot meals. So we get requests for food pantries. We have requests for um, people wanting to know how to apply for SNAP benefits, and just a wide range of food insecurity requests. And then housing and shelter, and that's ranging from everything from rent or mortgage payment assistance to those that may be homeless and seeking shelter or emergency shelter. And we have various employment assistance resources, child care, education. There's some healthcare and mental health information. Now, we are a comprehensive information and referral, and that means that we serve like a geographic area of the state. So we may not have like the depth of information you would get from a specialized information and referral, such as an area agency on aging that would have like a real a lot of resources for the aging population. While we may have some, we don't necessarily have that depth, but we do refer out to other agencies such as the area agencies on aging for more information to suit certain populations if they need it. And then we have requests for other household needs, and those could be from diapers to clothing items or things of that nature. So I did give a brief overview of what to experience when you contact us, but this just kind of gives a little more detail. So when callers dial 211, their calls are answered by one of our certified resource specialists, and they'll do their screens. Like they'll do like an information and referral assessment. So while someone may call and say that they're seeking food right now, we try and ask them a few questions just to find out if there are any underlying issues that we can help them with. So they may say that they've been laid off or they lost their job. Then that would lead to us offering them other resources such as job finding assistance. They can get that same service via text, because when you text to that short code 898211, you're responded to by a community resource specialist, the same ones that answer the phone. So you'll receive similar service via text. Because of the limitations of the text messaging, the conversation may not be as the conversation may not last as long, because sometimes people who are texting are kind of in a hurry or things like that. But we do try to do the same type of assessment. And then the web search, while if you search on the web, you will not be assisted by a community resource specialist, but you will have kind of guided categories and that'll take you through all of our resources so that you can look for yourself. But if at any time you get stuck or you need a little more expertise in searching through those resources or navigating, you can certainly give us a call over the phone or reach us via text, and we'll help you with that. But the website, again, is available to anyone across the state, and it's full access to all of our resources. Next slide, please. And just I'm just going to end up here with just a little bit of information about our database. So we do have our database curators, which are also certified by the Alliance of Information and Referral Systems, which is a national, well, it's actually international, because they accredit us here in United States as well as Canada for information and referral programs. But that makes sure that we keep standards and that our information is accurate. So these database curators that are at the local centers they manage the state resources locally. So they all have a relationship with the agencies that are in the database, and they can kind of contact immediately for updates or any change in information. And that is managing over 7,000 agencies with over 14,000 sites and 36,000 programs and services that are located throughout Michigan. And again, all this information is available at our website, mi211.org. And you'll also be able to search the database from our website if you're looking for resources. And if there are any questions, I can certainly answer those right now.
Thank you, Keisha.
Yes, thank you so much for giving us this information.
Thank you.
Yep. Thank you for having me. Like I said, you have my email address in the slides. So if you have any other questions, you can certainly feel free to reach out to me. You can also, like I said, visit our website, and all of the information is there, including links on how to get to your local 211's website based on your county.
Keisha, this is Kathy. I just want to piggyback on this and let everyone know that, and let you know that 211 is a main focus in our community resources guides that goes throughout the regions, the different regions that our offices and physicians are able to ask for. So hopefully you're getting some questions and some information needed out to people via that avenue too. So thank you for being here today.
Thank you so much for having me.
Thank you.
As most of you are aware, MPP has been talking about Persevia Care Space for quite some time. This is our new population health platform. The platform combines care coordination, real-time quality and utilization analytics and reporting, enhanced patient and provider engagement, and bundle payment management tools. This is replacing our MDI Symphony registry, and it is replacing CareSpective. As most of you probably know, MDI shut down on May 29th of this year, and CareSpective shut down on July 31st of this year. This will be provided to all MPP members at no charge. And this does also tie into the PCMH end domains of registry and performance reporting. So Persevia will be using real-time data to populate performance reports, gaps in care, and HCC coding opportunities. The new point of care tool is now called CareView, which has 58 metrics for monitoring revenue-based initiatives. Next slide.
Well, hello, everyone. My name's Andrea Phillips. I'm the Director of Care Coordination for McLaren Physician Partners. Thank you for having me today. I'm going to spend just a few minutes walking through the care management and care coordination services we provide your patients. Next slide. I always like to start with who we are. We are actually a team of nurses, social workers, medical assistants, and patient navigators. Patient navigators are healthcare professionals with other diverse backgrounds, such as occupational therapy, maybe nutritionists, and so on. So we have a team now, almost 30 individuals that provide these services across the state to both our independent and employed practices. Our goal obviously is to work with you to improve patients' experience, coordination of care, their outcomes, quality. And we do also have the goal of reducing avoidable costs. So those admissions that could be avoided, readmissions, excessive use of the emergency department for something that could be addressed at the PCP office and so on. Next slide, please. Okay, so the first program, most of you should be familiar with this. We've been doing transition of care for at least 2 years now. So your practices are very familiar with this. Essentially, in this program, we're looking at your patients that have been discharged. We're reaching out to them by one of our qualified providers within the first 48 hours or 2 business days to really go through some key elements of their discharge, make sure that they are successful at home, that they have everything that they need in that transitional period. We also work to coordinate their follow-up appointment with the office and address any other issues that have come up around social determinants, the need for ongoing education or support. And we also risk stratify these patients. Many of you know that that's a requirement of several programs. So we're risk stratifying them as they come out of the hospital. In addition, if you have questions about TCM billing, we are always here to help. There's a couple of us that specialize in this, and we will work directly with your practices to help you achieve the highest dollar amount for these services. Next slide. Our chronic care management program is really an extension of TCM and the incoming of referrals and patients that come to us through analytic tools. So for example, I run reports on patients within your practices that maybe they're extremely high cost, high utilization, they have 3 or more major comorbid diagnoses or problems. We work to get these patients into a chronic care management program where we're working with them on a regular basis to develop the best plan of care, the best monitoring. So for example, if they're a CHF patient, we have somebody checking in with them weekly on their weights. In developing those actions before the patient actually gets to a point that they have to, go to the hospital. But we work proactively with the practices to develop a self-management plan with that patient. There's no limit on the time a patient is in this program. It can be, a month, it can be 18 months. We really work with the practices to coordinate this patient's plan of care and send our documentation to the offices. Next slide. BPCI, so we call this our bundle patients. I don't want to go through all of the details. Certainly these slides, there's a lot more information. You can read them after. What is important for you to understand is that all of our hospitals participate in a bundled payment program for at least 1 diagnosis. There is a grid here. You can take a look at your region and your hospital and what patients fall into this bundle. What you need to know is that we're responsible for this patient's cost of care over a 90-day period. These patients are engaged by our care coordination team as well, and we manage them through that 90-day period. So when you get something from us saying, hey, this is a bundle patient, we've got them enrolled in our care management services for the next 90 days. In the back of your mind, what I want you to take from this presentation is know that we are held to a certain cost, a dollar amount for the next 90 days on these patients. So we're going to work with you. We're going to work with home care. If they went to a skilled nursing facility, we work with them to try and reduce any avoidable utilization. Certainly what that patient needs, we want to provide, but if there's something that we can reduce, we are working on it with these patients. Next slide. SNF care management program. So the other thing I want you to know about this is when your patient is discharged from the hospital and if they go to a SNF, a skilled nursing facility, for those of you who may not know what a SNF is, we also have care managers that follow those patients. So we connect with that SNF. We talk about the expected length of stay. We make sure that that patient's progressing through their therapies. We work with the social work and the case managers at the skilled facilities to identify any potential barriers to discharge. So there's a lot of work going on behind the scenes that you may or may not be aware of. Again, our goals are to reduce avoidable lengths of stay, make sure that they have the right care at the right place, the right time, and really oversee a smooth transition to home. Next slide. We also have an ED frequent utilizer program. I'm sure most of you as office leaders have seen reports that come from us where we may provide you with a list of patients. Here's your patients that have been seen, 3 or more times in the last 3 months in an emergency department. Please take a look at them, review if there was something avoidable. Bring that patient in, have the conversation. We also, depending on the type of utilization, we attempt to engage them in one of our care management programs. An example here just recently that comes to mind is we had a younger gentleman that had 14 ED visits in a 2-month, I want to say a 2 or 3 month period. And they were all for hypertensive crisis. So, I mean, that tells me as a nurse, okay, he's not managing his high blood pressure. What's going on? This should be a simple fix. We reached out to him and it turns out that he had just been too busy to see his PCP, didn't make the connection that his ER visits really needed to go back to having his blood pressure medicine on a regular basis and then getting that relatively cheap from Myers or any of the participating pharmacies where it was only like $5. So we were able to connect him and he has not had an ER visit since. So that's the kind of work that we do. And we work primarily with the ACO and Medicare Advantage populations on this, but we do take referrals from any of your practices, any payers. Next slide, please. This one I'm really excited about. So provider delivered care management is really a Blue Cross program. But why I'm excited about this is one, it's recognizing that there's a lot of work that's done in the practices trying to coordinate care, improve outcomes for patients that that historically has not been captured. This program allows you as a practice and your providers to start capturing some of those codes and activities that you do on a regular basis. So if your doctor calls over to the ER and says, I'm sending Miss Phillips over there, she's got chest pain, but we did do a stress test a week ago, it was negative. They're communicating vital information. That work goes on every day between our hospitals and our providers, but now there are codes to actually capture that work that are billable. This program also promotes having care management services in collaboration with the practice and the physician, where if there's ongoing outreach that needs to happen or looking to close gaps in care or somebody who's been newly diagnosed with a disease and you want to reach out and make sure that they understand, how they're going to manage their diabetes, etc. In addition, there's significant amount of revenue attached to these programs. We know Blue Cross has not increased their fee schedule in many, many years. So one, all of these services are billable, so there's a fee for service reimbursement, but also if you meet specific targets, your practice is eligible up to 128% of the fee schedule. So we are working with our practices to get on board with these services. I don't want to spend too much specific time on it, but please reach out to us after the presentation if you want more information. We have some specialists on our team that can work directly with you and your providers to get this up and running. Next slide. So documentation is very important right now because we've got disparate systems, across the entire state. The documentation is not always coming from one system. So we use Persivia, as Jen had mentioned and talked a little bit about our Persivia, our population health platform. We are working to transition everything into Persivia, but we're still using all scripts and Cerner in some cases. So your documentation may look a little different. So the next couple of slides, if you can just advance them, Sierra, so that they can see what it looks like. But it will always say, care coordination or transition of care. This information needs to join the medical record. In some cases, we're able to actually put it right in the EMR, especially with our employed practices. But for those that are independent, we're sending this to you through your preferred mode of communication, whether that's a scan or a fax. Make sure that you see it, your provider sees it, and it joins your record. That's also important for billing. We are working on other methods to standardize that, such as direct messaging, but we're still a little way ways from that, but hopefully next time I talk to you guys, that'll be in place. So so what we ask of you and of the practices, one, submit referrals to us. Everyone should have that referral form. If not, it can go out in an attachment with this presentation afterward. But we accept referrals on any of your patients, regardless of payer. Two, if you get a request from a care manager, I need you to recognize that these are really extensions of your practice. They are acting on your behalf. And if they call, there's usually an issue. Our policy is we only call the provider if there's a problem. Everything else is communicated to you through that documentation. So if we call, it means we're trying at that moment to fix something for a patient, whether it's a medication question, an error on discharge that needs to be clarified, or the patient has an acute issue that doesn't really require the emergency department, but we need that doctor's guidance on the next step. Obviously, the 7-day follow-up for TCM, of course, it's reimbursed up to 14, but 7 days is truly the best practice. Please work with your providers and our care managers to get those patients in within 7 days. There's also, higher reimbursement associated with that, but we know that most patients that get readmitted do so in that first 7-day window. So the sooner we get them in, the better the outcome for the patient. Next, I talked a little bit about that, making sure documentation gets to the record. And then again, we have a whole team of experts around TCM coding and billing and PDCM. If you have questions related to those programs, please reach out to us and we are happy to work with you. Next slide. I've included my contact information here as well as Sandy Cult's. If you have an MMG patient-specific question, we still have a dedicated MMG North and South team. Feel free to reach out to them if it's specific to transition of care. Otherwise, Sandy and I can take any questions. Just send us an email or look us up and give us a call, and we'll get back to you as soon as we can. So thank you. I'm not sure, Sierra, if we're going to open it up, or Amy, for questions, or if you're waiting till the end, but I'm certainly available if there are any.
We were waiting till the end to take questions.
Okay, thank you.
You're welcome.
Okay, so I'm here to talk about the 2020 CI scorecard. This is a payment that MPP sends out to our providers twice a year. In order to be eligible for this payment, you must be a MD or DO. You must have a MPP membership of level B or level C. You must be an MPP member at the time of payment, and you must participate in the MPP value-based contracts. We did send a letter of methodology out in December of 2019, but we've also included a QR reader below if you needed to reference those documents. Some key takeaways to remember about these scorecards is that there is 2 payment periods, the first one being January through June, and the second one being July through December. The next part is the physician education. There are 2 required modules for each of the payment period, and those are posted on our website. We'll go over that in a little bit. We also have a MPP spring and fall update for the physicians that they must attend to achieve credit. The fall update was done on October 21st, but if the providers missed the live opportunity, it is available on our website and it has already been posted. The next part is our quality metric submission. So for the ACO, you automatically get credit for this category, but if you are not in the ACO, you must submit your quality metrics to your MPP Regional Quality Performance Specialist every year. This would include examples of your MIPS quality or your hospital quality metrics or national registry metrics. And then the attestation of submission of quality measures does not satisfy this metric. Continuing on, the TOC annual well visits and HCC coding. These metrics are based off of the McLaren High Performance Network ACO claims. So it's highly encouraged to join the ACO to achieve these points. We've also had an increase on focus of PCMH and PCMHN capabilities. One key point to remember is that all the payments are made to the employer. So it's either made to MMG, the hospital, or the payee on file if independent. So it is important to get us a updated W-9 if anything changes within that information. Minimum score for payment, that's 55 points with a minimum of 10 points in the quality metric composite score for our PCPs and a minimum of 60 points for our specialist. And our quality metric score, we use year-end results for both payments. So this 2020 payment will be using the 2019 results. Next slide. So here we've listed the PCP, an example of the scorecard template. Some things that we can focus on between now and the end of the year to make sure that your physicians are getting the required points is make sure that they're logging on to the website to complete the physician education and the physician update. Those are both posted on the website. Like I said, we'll go over, I think, in the next couple of slides. For the quality metric score you can always reach out to your regional quality team to go over any quality scores that you may be questioning or just kind of see where you're at. Also, we're available for PCMH questions if you wanted to know how many capabilities you have in place or how you can improve the amount of capabilities that you have. And then Andrea just went over the TOC annual well visits. And then the HCC coding, the regional medical directors are a good place to go to for questions on that. So moving on to the specialist scorecard. That's the same thing between now and the end of the year. Make sure that you're logging on to complete the tasks on the website. Same thing with patients on a medical home neighborhood capabilities. Reach out to your regional quality team. And also if you are not within our ACO, make sure you are submitting those quality metrics to your regional staff. And lastly, for the evidence-based medicine, you should have received a monkey survey to attest to that. But if you haven't or you're unsure, you can always reach out to us too. Thank you.
Hi, everyone. This is Kathy. Thank you for joining us today, and I hope you're enjoying the information we're providing. We're excited that you're here. I'm going to take a few minutes and talk to you about the physician education and the fall webinar. Both have been posted on our website for viewing, and this, as Amanda has said previously, is a very important part of your scorecard. So we need to make sure that the physician education, there's two portions of that, and I'll go a little more in depth on this in the next slide, and the fall webinar are very important to your physicians. Note that you cannot complete this for your physician. The physician, we're engaging them, and this is what they need to do. The best thing you can do, though, is to encourage them and to help them make sure that they have created a login. There's instructions that were sent out multiple times. The latest ones were the newsflash of 10/2/2020. Anyone on your quality team can help get that information to you, and we're happy to walk you through it so you understand what your providers are trying to do. They also have a report that is generated in the background for credit, because we also have credit is compulated in several ways. One is so they get scorecard credit. Also, they can also get CME credit upon available completion of it. This is our website, www.mclarenpp.org, and this is what it will look like when they go to the website to start it. So on the next slide, I'm going to talk about a few more things that I want to bring to your attention so you can help your providers. Now, the first critical step is for the provider to create a login. A lot of your providers have created a login, but for those that haven't, they can't get anywhere until they create this login. Once they've created the login, they now have an account which is all about them, meaning it has their latest information regarding their scorecard information, their education history, how to change their password, etc. And that can be found in the MPP members area, which you can see on the left side of the screen. Twice a year, the providers need to do their physician education and attend or view the physician update webinar. The screenshot shows you exactly what they're responsible for right now. Is the PCMH and VBR webinar and the stress testing webinar. These are the two separate items that they can receive points on their scorecard. Right now, as Amanda had said, I'm proud to announce that we had our live webinar last Wednesday. As of yesterday, only a week later, we have the fall webinar posted for the physicians to go in and view. And I'm really proud of the fact that we've been able to do that so quickly, because I think that's really going to help you and us keep them doing the things that they need to do to get this credit. So right now, to fulfill the July through December requirement, there are 2 physician education pieces, like I've said. And as they view the education and webinars, a report is created in the background, which goes ahead and gives them the CME credits upon completion. The final thing I'd like to ask you to do is to make sure that the provider creates our website, www.mclarenpp.org, as a favorite. That's going to help you and them when they get all these news flashes and reminders from your quality team to go in and do this education. If you have any questions, I'll be happy to answer them at the end of the presentation. And thank you again for attending.
Hi, I would like to talk to you about our McLaren High Performance Network, our ACO. We had to do our MIPS reporting this year, and I just would like to share with you our success. We scored 96.9 out of 100 for the performance year for 2019, and that will give us a 1.58 positive adjustment for claims in the year of 2021. By improving these metrics, if you'll go to the next slide, please. We were able to save CMS, excuse me, money, and that was a savings of $37.1 million. And we received 17.3 million CMS, and we're going to be able to share with the ACO providers $8.4 million, which is a huge success for us. The ACO payment should be going out either the end of this week or the beginning of next week. And again, these payments also will be sent to the hospital, MMG, or the payee for the independence. Thank you.
Hi, I'm Janet Leitz. Welcome. And what I want to go over with this slide, this represents the breakdown of our 2020 Blue Cross patient designation results. So as you can see, there's 109 out of 134, or 81% were designated. This is a 99% decrease over the prior year. We would like to recognize 2 regions that achieved 100% designation, and that was Oakland and Northern. So kudos to them. The top quality and utilization ranking of 98.3 in all of the PGIP was Petoskey Family Medicine. Congratulations to you. There are some barriers that go along with designation. 2 practices did not have the minimum of attributed patients, which is 30 members in 2 metrics needed in order to receive a quality and utilization score calculation. 3 practices of 2020 was their first year nomination, and that was Dr. Arja out of Lapeer, McLaren Thumb Ubley Practice, and McLaren Southside Medical Center and Urgent Care. So the practices that are new to patient-centered medical home typically have a harder time achieving designation if they are not used to the requirement. The 19 remaining practices did not achieve the quality and utilization 20th percentile threshold across PGIP practices for designation. But the analysis of the results revealed no single common reason for low performance. It could have been that the office may have had low scores in adult quality, while others may have performed lower in child or adolescent prevention. Next slide, please. So here's a little update for patient-centered medical home. Starting September 1st of 2020, Blue Cross designation program will be a 2-year designation. So the practices earning patient-centered medical home designation VBR on September 1st will not be awarded until August 31st of 2022. So in the meantime, you must remain current with program criteria, required capabilities, which we try to increase through MPP, and a QU threshold. Additional VBR, such as PDCM, PDCM Advanced, MAT, and co-care will be evaluated annually. At this time, there are 163 active patient-centered medical home capabilities. Next slide, please. So this is for PCPs only. You have to have 50% of the practice score is based on patient-centered medical home capabilities. You have to have acquired at least 50 capabilities that are reported in place. There are 15 required capabilities, 6 established, which are in black, and 9 new for next nomination, which are in white. Next slide, please. So the steps to designation. What we like to see is outreach into eye specialists for prior care relationships and updated reports from July 31st of 20. Our statin metrics, August 20th through the 20th, 2020. Education in the clinical corner on MPP website, news flashes, MMG newsletters, and then our patient lists distributed to the physicians. So use of Persivia for supplemental electric data in 2020 is in validation. The validation is in process right now. Controlling high blood pressure education program that was just developed recently is in process. We just renominated practices that were not designated this year in October. And we have developed detailed action plans for the non-designated practices. So what we're looking to improve quality performance and through abstraction and outreach for open gaps. Next slide, please. Oh, thank you.
Hello again. As some of you know, MPP created a blood pressure education module for 2020. The reason behind this is that MPP as an organization has performed poorly year after year in this metric. So our objective was to provide proper blood pressure education to the medical assistants and providers in order to improve medical record documentation, leading to improved annual ACO quality performance rates and overall HEDIS scores for the year on 2020. On October 9th, MPP's phase 1 blood pressure education module and attestation sheets were distributed to all independent PCPs and independent specialist office managers contacts for all medical assistants as a QR reader video module. The attestation sheets were due back to your quality performance specialist by the 16th of this month. Your practice coaches have also reached out to obtain some necessary office information. All employed MAs will receive this module as well within their McLaren University, but which will be due before the end of the year. Providers received a news flash and a tip sheet to their emails on file with MPP. Couple reminders, if your office does not have a process in place for elevated blood pressure repeats, please do so before the end of the year. Your MPP quality staff can help you with this. Another reminder, if you have not sent your attestation sheets or responded to your practice coach, please do so before the end of this month. Because based on independent PCP performance, additional education may be needed before the end of the year so we can have make a difference in the year-end scores. Thank you.
Hi, this is Judy Karpinski. I'm going to talk to you about the MPP Top 10 metrics. If you follow these metrics and look at these and actually kind of adhere to them until the end of the year, you will be getting in most of your gaps and improve your quality scores through these. I won't read these to you, but all the specifics of each one is next to the measure title. Please read those because a lot of these can be confusing for people because of the time frames. But a couple of key measures I'd like to point out is that if you are, like Jen said, if you're doing a blood pressure and it is 139/89 or above, we cannot use that. Please take a second blood pressure and we can take the best out of the systolic and diastolic blood pressure if we get ones that are that will reach that measure. So please take it twice, have some kind of process in place for that. Excuse me. Another thing is please adhere to the A1C guidelines. At least do your A1Cs twice a year. We're finding really very, very high A1Cs with no follow-up on them. Other than that, try to use the chart prep. Any kind of chart prep that your office is using will help you in this until the end of the year. I know the Flint region is using the adult prep guides that the RMD has been trying to put in place. Those will help you hit all these measures and increase your quality scores until the end of the year. Pre-visit planning is probably one of the best things that you can do in order to do that. Please reach out to any of your quality team. They will help you with any gaps in care. They will give you what the gaps are for any of your payers. So if you want an actual list of who these people are, please reach out. We'd be more than happy to give these to you. Thank you.
All right, everyone. Now it's an open forum. We want to hear from you. You've been listening to us. We've given you a lot of information. Hopefully you find it helpful, but how can we assist you during these uncertain times? It's been difficult for us to know exactly what we can do to help you. We don't want to reach out too many times, but we don't want to be a stranger either. So let us know, how would you prefer us to distribute hard copy items to your office? Do you need hard copy items? Do you find that it is working well by us sending you things via email? Do you like this type of a forum where it's virtual and you can come and go as you want and that you can see maybe posted afterwards? What additional resources can we help you with? What is the best media to communicate updates to your office? What we wanted you to know is that when we send you the Survey Monkeys, it's very important that you give us your feedback. We're not going to be able to do anything for you unless we get your feedback. So please take a few moments. We're getting pretty savvy about doing these Survey Monkeys, and we love the responses that we are getting. Your responses really do make a difference, and they help shape us to give you good presentations like this. And then again, please feel free to contact your quality team. Our team has grown. We want to make sure that we're here for any assistance or resources. So I'm going to we're going to go into the chat box and see what we have.
I want to take a moment right now to ask anyone who has called in and don't have their name up, please add that to the chat box so we know who attended the meeting. Thank you.
All right. Okay, I see in the chat box that Dina had sent out that the PCMH VBR is effective from 9/1/2020 to 8/31/2020. It's a 2-year designation, so we just want to clarify that for you. I don't really see anything else. Just make sure before you, as you leave, or if you have his phone number, please go ahead and give us your name associated with the phone number. That's important to us also. Thank you, Terry. And again, after the presentation, if as you're going through your daily work and you've decided that, oh, I wished I would have asked that question, or I don't know why I didn't ask that question, reach out to your quality performance specialist, your quality team, your practice coaches, your QIS, QAs. We are a total quality team for you going into care coordination. We are your resource. Please reach out to us. I'd like to thank our presenters also that came. These slides will be available. We will send out a notification. You can reach out to us to get these slides. I'm not sure exactly where we're going to post them right now, but I know that your quality performance team will be able to have these for you. I think they're a great resource. We always tried to do it when we had our independent meetings also.
Hey, Kathy, can you hear me?
Yes, I can.
So this is Larry Council. I'm the Senior Medical Director at McLaren Physician Partners.
Hi, Dr. Council.
Just wanted to say I was really impressed with the degree of information that was presented today in this key staff meeting. Just for those folks who may be just joining us, as you can see, there is so much information. There are so many things to do. There are so many metrics to meet that trying to do this alone is virtually impossible. So please utilize the quality performance staff that is available to you to help with particularly population health management in your office. This concept is relatively new, particularly for the older physicians, because we were pretty good at taking care of patients that were in front of us, but now we're asked to handle populations of people. So not only the people who are sitting across the room, but the people that you never see. So this concept is very new in medicine, and it's difficult to put your hands around this, but certainly the quality performance staff can help you do that. And along those same lines, particularly for all of the physicians who are on the line, as well as the administrators, it is important that our quality performance staff gets to see the provider. It doesn't have to be for an hour, doesn't have to be for 30 minutes, but access to the provider is imperative for our success, particularly in this risk-averse and performance-based era that we're in. So please, when the quality performance staff comes knocking on the door, please let them in to see the provider. That's all.
Oh, thank you, Dr. Council. I appreciate you giving this information out. As I look at the chat box and everything, we can email them. Last time, Jennifer reminded me that we did email them to everyone that attended on that we have listed. So we will be sending those out then. And if you don't get an email from us, please, again, reach out to us. Another good resource is your regional medical director. So that information is on the slide. And I'm hoping that everybody has enjoyed their time with us. We want to be respectful of time. It's an hour and 3 minutes. So with that, if there aren't any other questions, we'll let you get back to doing what you do best, taking care of your patients. Thank you so much.
Thank you, everyone.